It's Chasin, cosmetic physician here at Reflections in New Jersey. Number one, I wanted to thank everyone for their great questions. I hope to answer them and to give you great information today on our subject of the day, which is talking about methods of hair restoration. If you like our video, please give us a thumbs up and please subscribe to our channel so we can keep you current on what's new in cosmetic medicine. Thanks again for the questions.
So our first question is from Mike in Basking Ridge. He says, I'm a young guy. I just graduated high school, and I've already noticed I'm losing hair on the top of my head. What can I do?
So, Mike, common question, early hair loss. And as most people know, there's a very strong genetic predisposition. So, for hair loss, in other words, they'll look at a parent, they'll look at a grandparent, and they'll see early hair loss, or they'll hear about early hair loss. And what people don't know is that it can happen from either side of the family. A lot of people think it's just from the maternal side, but it can be either side of the family. And the key is early intervention. Even the use of topical agents such as minoxidil can greatly slow down hair loss, especially if used early. Other things like vitamins, Nutrafol, Viviscal can also influence the amount of hair that someone loses over time. So early intervention is key, Mike. Great to spot it. Now treat.
What about lasers for that?
So lasers are also, great question. Lasers are also a great use of energy to do something terrific, stimulating hair. Uh, there are hundreds and hundreds of different lasers on the market, but there's only a couple that have been really shown to be effective. One of them is called Capilis, and that is probably the most well-known of them all. And that's something that can either be used every single day for a very short period of time or 3 or 4 times a week for about 20 minutes at a time. And there is real good research about the efficacy, in other words, the effectiveness of low level laser.
Our second question is from Trey from Bedminster, New Jersey. He wants to know, is it true there are shampoos that will work to grow your hair back or pills? What can I do at home that will actually work?
Great question. So, in terms of shampoos, unfortunately, there are thousands and thousands of different shampoos on the market, most of which have no science behind them. There are keratin, there's biotin, there's all these different things. They haven't been shown to do anything. There is a great shampoo called 82S, which actually has topical finasteride and topical minoxidil, which are two agents that have been used for many years to combat hair loss, and that has been shown to be effective. So, really important to talk to a professional that knows about hair restoration and use something that has science behind it. In terms of medicines, the well known medicine for males is called Propecia. Propecia is effective at decreasing hair loss in up to 90% of males. 90%, big number. It's something that should be used early before you've lost hair because it's not as effective at stimulating or regrowing hair. It's better at preventing loss. In women, we use something called spironolactone from time to time, and that is an agent that can then actually help with hair growth as well.
Are those prescriptions?
And both of those medicines are prescriptions, and one has to evaluate the scenario behind the hair loss and make sure they're right for you.
So, Matt from Hoboken said, I want to do a hair transplant surgery, but my friend did one and it only lasted for around 2 years. What can I do to improve my results?
So, two things. When someone has a hair transplant and then notices hair loss, it can be two things. It could be one, that the transplant didn't work well, that those new hairs are just not healthy enough. The second thing may be loss of other hairs. So, just because you transplant some hairs, it doesn't mean that the other hairs in the area will remain healthy. So, this is when we use topical agents or even injectables to stimulate hair growth. So, it's very important. A hair transplant isn't the end of treatment. Hair loss is a chronic condition, so we need to treat it over time.
When you talk about injectables, you mean PRP?
So there are different types of injectables. The most well-known type of injectable uses platelet-rich plasma, or PRP, which actually comes from our own body, where we concentrate the platelets and deliver many what we call growth factors. And these growth factors can stimulate the body to produce hair from the hair follicle. We very often will mix it with other agents to make that process even more effective.
So our next question is from Sophie from Warren, New Jersey. I know hair loss for men is hereditary, but what causes hair loss in women?
So hair loss in women is extremely common. In a hair restoration practice, we actually treat more women than men. And there are different reasons women lose hair. One is genetics, like men. The second may be a hormonal issue, even thyroid issues. The third can be pregnancy. Fourth, menopause. And even stress can be a cause of hair loss. So hair loss in women is extremely common. It presents a bit differently than men, but early intervention, treating early at the first sign of hair loss, is critically important to have a successful outcome.
So our next question is from Alec in Watchung, New Jersey. How much does hair restoration cost, and are the results immediate?
So hair restoration injections vary greatly. Sometimes people will just use platelet-rich plasma. The positive of platelet-rich plasma is it comes from our own body. There's no artificial substances. The downside of platelet-rich plasma alone is that it has to be done very frequently, once a month for 3 to 4 months, and then 2 to 3 months later. So one's doing 5, 6, sometimes even 7 treatments during a 1-year span. When we mix platelet-rich plasma with other agents, such as A-cell or Bio-D, which is a tissue matrix, is a substance that is derived from placenta, that has many, many different growth factors and other agents that stimulate hair growth. So now we can generally do one treatment, and that will last at least a year. So it's a more cost-effective thing. It does cost a few $1,000s, but it's much more cost-effective than doing something once a month many times throughout that year.
Tina from Madison, New Jersey asks, are there studies that prove hair restoration injections work?
10 years ago, when we started doing hair restoration injections, we would do them and we'd say, wow, it works. First we said, we think it works. Then we said, wow, it really does work. But there was no science. Now there are hundreds and hundreds of different studies that prove hair restoration injections are real. Great science that proves their efficacy, their effectiveness.
How often are there complications?
Complications are extremely rare because, again, we're using natural products. We're using products from our own body, and we're using what we call allografts, which are products derived from the human body to stimulate hair growth. So complications should be just extremely rare, and downtime usually non-existent.
So Natasha in Chatham, New Jersey, she asks, I recently had my first child and I've lost a ton of hair since giving birth. Should I be worried, or is this one of those weird pregnancy things? At what point should I start to worry?
So hair loss after pregnancy, very, very common, and it occurs due to the fluctuations of hormones in the female body. And it usually stops by a few months. If someone is noticing it's not stopping, they're losing hair in clumps, they're starting to see thinning of the scalp, early intervention is really important because we can turn off that process very easily using injectable agents. So people shouldn't just go on and expect that if it's there for 3 months, 6 months, a year, that it's eventually just going to stop. We want to intervene and make sure it does stop.
Since she had her first child, can you do that while breastfeeding?
So platelet-rich plasma, because it's made out of your own products, can actually be done at that phase. Medicines, however, we need to scrutinize what medicines we're using, because certain of these medicines won't be okay to use during pregnancy, during pregnancy, or actually during breastfeeding. After pregnancy and after breastfeeding, we then institute those medicines otherwise. But platelet-rich plasma is actually made out of our own products. I mean, they're made out of our own platelets, so they're safe.
Awesome. So Chris from Short Hills says, I hate that I'm bald, but I don't want surgery. Is there anything that I can do that will actually work for me?
Great question. If someone has lost all the hair, in other words, the scalp is bald, there are no medicines, there are no injections, there are no topical creams that can regrow hair. I don't care what the internet says. It cannot happen. If someone has hair in a different place, It can be transplanted during a hair graft to that area of balding, but if the hair is totally gone, you can't grow hair from that area. The key is to catch it before that occurs. Before hair goes away, before there is true baldness, hairs become fine, they become unhealthy. And that's the period we want to stimulate hair growth and thicken that hair and prevent that hair from falling out in the first place.
Yvonne from West Orange, New Jersey, she asks, are there hair restoration treatments that work specifically just for women?
So the process of hair restoration in females is different than males in that the medicines we use are different. So we may use different concentrations of minoxidil. We may use an oral medicine called spironolactone. We may use other kind of hormone supplementation. So it is different than male. Is a medicine called Propecia, which 95% of the time we're actually using in male, but we're starting to use this in females that are postmenopausal. So it's very important to sit down and understand all the options. Though there are a lot of similarities, again, there are many differences between female and male pattern hair loss, what it looks like, and how we treat it.
Lynn from Edgewater, New Jersey, wanted to know, is hair loss treatment different for women than it is for a man?
So hair loss treatment, again, is specific to the period of hair loss. In other words, how much hair is lost, what area we're losing it from, stage of hair loss, female, male, and other health related concerns. So it really is an individual problem. And when you sit with a hair restoration specialist, you want to ask, for me, what is my best course of action? So no two people are alike. Their situations are different. And that's what's sometimes so clumsy about the internet, because you'll read about someone's experience, and it may be a positive experience, it may be a negative experience, but it may really have to do with their specifics, their age, their degree of hair loss, their genetics, health issues, many variables. That's why it's very important to speak to a healthcare professional and understand your options and details.
Well, those were all our questions so far today.
So we thank you. These were great, great questions. And my feeling is the more you ask and the more you inform yourself, the more you can be your own advocate and make sure you do things that are right for you. So the internet's a wonderful place to learn. Unfortunately, there's a lot of misinformation. And in the marketplace, there are many different kinds of things that are out there that just have no science. So when someone is investing their time as well as money, you want to make sure you're investing in things that have science that have been shown to work. So really, again, I appreciate the questions. They're phenomenal, and we look forward to continuing to educate you in the future. Thanks again.